Hi. Hi. My name is Jonathan, and I'm a behavior change specialist for Lehigh Valley Health Network's Comprehensive Health Services at 17th and Chew Streets. I work primarily with HIV-positive individuals who are diagnosed with a substance use disorder. My colleague Vivek and I, we provide our patients with a brief intervention, referral to treatment, and follow-up. Before I share our CHS story, a few things I would like to share with you today about myself, I guess. Number one, I'm very nervous. Thanks, thank you. Number two, I am super happy and privileged to stand here in front of you, sharing about the work that we do. Not too long ago, I was in one of these seats for orientation as a new hospital employee. So this is pretty cool. Number three, I love the work that I do, our patients, their resiliency, the learning. I'm very passionate about psychotherapy, mental health, working through my own stuff, and all the complex things that makes us human. I'm also very fortunate to work with a great team, my CHS family. We're a team of about 60 strong, doctors, nurse practitioner, nurses, pharmacists, case managers, behavior change colleagues, our clinical supportive staff, outreach, prevention and testing. Our staff works day in and day out with some very challenging cases with one goal, and that is to get patients to take their HIV medications. Because we know that if you take your medications, you're undetectable and therefore uninfectable. U equals you, right? So a lot of patients with whom I work have faced a lot of traumas, significant challenges. Your patients who have been hurt as children, sometimes abused, neglected, patients who have lost hope, lost trust, lost family, loved ones, patients who feel alone or may be alone. They have lost jobs, are homeless, patients are members of the LGBTQ community, chronic relapsing individuals. And in the midst of all these challenges that they're facing, they became HIV positive. That's our starting point. Now think about that for a moment. Substance use has taken everything from that person. And now this? That's tough. That's really tough. No one wakes up and says, you know what, today's the day I'm going to shoot up and ruin my life. And as clinicians, we know that substance use disorder is a disease. Unfortunately, when patients share that they have a substance use disorder, people run away, right? As opposed to having some sort of other diagnosis or condition like, let's say, cancer, when people flock to you, right? Stigma is real, but not here, not in our clinic. We have patients who come in high, drunk, detoxing, frustrated, suicidal, going through substance-induced psychosis, literally at their worst. We also have patients who said or share that enough is enough. We work really hard to make our clinic a safe space for our patients. We educate our colleagues on being trauma-informed and are very careful not to re-traumatize them. We're very compassionate, we're caring, and this is evident when our patient comes to us in a crisis. Oftentimes, we are that constant in their lives. We're very fortunate that for the most part, our patients stay with us for a long time. Unless they relocate or they pass, we end up working with them for years. We see our patients, that special arrangement that we have allows us to see our patients as human beings as opposed to a 30 or 45-minute billing code. Now, things begin to look different that way. We have the gift of time, we have the relationship, and then we start to peel at that onion. Now, I am more trauma focused in the work that I do, and my colleague, he's more CBT or cognitive behavioral. Both are great, a little different. I utilize this really neat Jedi mind trick, I love Star Wars, technique called EMDR in my work. And this helps my patients with motivational enhancement, working through some of their trauma, and connecting the emotional and the logical brain. It's really cool stuff. Sorry, just lost my place there. Give me 1 sec. Sorry. There we go. The guy said it was 1 click, but apparently it's more than one. Good job. Thank you. Thank you. Okay. Da-da-da-da. All right. So, anyways, logical brain, the other side of the brain, Jedi mind stuff. I know where I'm at. So I always thank I always thank my clients for allowing me to be a guest in their lives as we have our sessions. I thank them for sharing and creating a safe space for them, free of judgment, with validation and empathy. Our patients slowly begin to share their most intimate details of pain, hurt, and suffering. And in between those commas, I hear hope, resiliency, and strength. Talk about bravery. Allowing yourself to be vulnerable with a stranger. Right? So I keep a few reminders or mantras that I work by throughout my work area. And some of them are, all of who you are is welcome here. Now let me say that again. All of who you are is welcome here. Love wins. Your mistakes do not define you. Don't give up. You matter. You are worthy of love. Hope and therapy is cool because let's face it, it's pretty cool. I get a lot of my inspiration not only from my clients, but also from my colleagues as well. When my colleague says to me, let's save some lives, I'm like, wow, yeah, let's do that. Or when a colleague would remind their group, reminding them to meet the patients where they're at. When they show up an hour early, an hour and a half early, you're like, what the heck? Yeah, we're meeting them. They're here now. Let's do this. Or when a doctor says to me, I remember when you shared about relapse being part of recovery. I want to work with that person again. Okay. Things like that. Or even when a person's still using a substance, but now they're taking their medications. Think about harm reduction, right? To be open to new ideas to help motivate our patients. So this whole concept of being open-minded, I think that's been shared throughout the evening. Now, sometimes the challenges related to effectively treating substance use disorders can feel insurmountable. It's a lot. But our team is ready. We're innovative, and we're incredibly supportive of the recovery community. And I want to end on one final note. I have a 13-year-old and a 3-year-old. So when I put my 3-year-old down to bed, because the 13-year-old does his own thing now, which is awesome. The 3-year-old says to me, Daddy, let's talk about our days. And he says, what did you do, or what's your day like today? And I said, how was your day? Oh no, he says, how's your day, Daddy? And I said, good, my day was good. He's like, what did you do today? And I say, I help people. And he says, good job, Dad. Thank you.